Good morning, good afternoon, and good evening. My name is Dag Rekve. I'm a Senior Technical Officer in the World Health Organization's Alcohol, Drugs, and Addictive Behaviors Unit in Geneva, Switzerland. Thank you very much for the invitation to present an update of the Global Safer Initiative here at the Global Alcohol Policy Alliance Virtual Event for 2022. This presentation is made in collaboration with my colleague, Dr. Sarah Roach, and also with input from many of the global safer partners that we have. In the previous presentations in this session, we have heard from global experts about the range and magnitude of alcohol-related problems, including harms to others. We have also heard about what are the most effective policies to reduce this alcohol-related harm. In addition, we have considerable global commitments from member states of WHO to reduce alcohol-related harm, first and foremost through the Global Alcohol Strategy endorsed in 2010, through the Global Action Plan on NCDs, which lists alcohol as one of the 5 key risk factors for non-communicable diseases. But in addition, also the UN family, by adopting the Sustainable Development Goals, have by its target 3.5 said that reducing alcohol-related harm is of a key importance for sustainable development in the world. So we have enough knowledge about the problem, we know what are the solutions, and we have decisions in place. I know that many of you would probably like to have more commitments and more binding commitments from our member states, but there are considerable decisions already in place to support implementation of cost-effective interventions at the national level. So time is overdue for action, even though I must say there has been action in several countries throughout the last 20 years. But we don't see enough effect of these actions, and they are very small compared to the size of the problem and also in size of the challenges that we are encountering. From this grew the idea among WHO colleagues and United Nations agencies colleagues and civil society collaborators that we needed to do some more. It's time to deliver, and as such, SAFER was created. SAFER aims to advance national alcohol control priorities and help achieve global commitments to reduce harmful use of alcohol. But SAFER can be many different things. First and foremost, SAFER is an acronym for the most cost-effective interventions to reduce alcohol-related harm. It's about availability, it's about drink driving countermeasures, it's about facilitating access to screening, brief intervention and treatment, it's about comprehensive restrictions and bans on advertising, sponsorship and promotion, and about raising prices on alcohol through excise taxes and pricing policies. In addition, SAFER is a technical package and guidance that outlines ways in which countries can implement the 5 SAFER interventions. And SAFER is also a global initiative with partners from not only the UN family, but also from civil society organizations. But the Global SAFER Initiative is not the only way that the 5 most cost-effective interventions could be implemented at national level. They can be implemented in many ways through technical assistance and guidance from WHO, through concerted efforts from our family, UN family, and also from civil society organizations and by member states themselves. And I think that is important to keep in mind when we talk about SAFER. That is not only the Global SAFER Initiative, but it has many different aspects with it. And some people can be a little bit lost in all these different perspectives on what SAFER is. But first and foremost, SAFER is a way to create safer communities, safer workplaces, safer roads, safer upbringing, and a safer world with less alcohol-related harm. We have 3 different work streams in SAFER. And that is, first, we have the global WHO-led package of technical guidance on effective policies, program, and interventions. Then we have a WHO UN-led operational program with partners focusing directly on country action. And we have multi-stakeholder advocacy, communication, and resource mobilization efforts. We have also lifted up 3 strategies that we think is important. Implement, and often that is seen as an overarching strategy, but we have also lifted up monitoring and protection of undue influence from alcohol industry, but also evidence-based and robust policy-making processes. There are many things that can go wrong in this process. So these are the 3 strategies that we also have established as key pillars in implementation of SAFER. I would like to stop a little bit around the protection from undue influence, and because I know many of you are concerned with that this is something we talk a lot about, but we have very little guidance on how well and how good we can protect from undue influence policy-making processes around alcohol-related harms at country level. And here I think the Global Action Plan from 2022 to 2030, which just recently was adopted in the World Health Organization in May, can give some guidance and some fundament for operationalization protection from undue influences. Because in the action plan there are several paragraphs where the economic operators are invited or encouraged to many things. And here I will focus on the things that can become the basis for this operational framework that we are talking about. First of all, they are invited to focus on the implementation of measures which are stringently within their core roles as developers, producers, and distributors of and sellers of alcoholic beverages. And here, the word stringently has been introduced in comparison with the global strategy, for those of you who know the global strategy very well. And I think it focuses on an even stricter border around what is the core roles of economic operators in this sector. They're also invited to abstain from interfering with alcohol policy development, which is a broad topic, of course, and need further guidance from, for example, refrain from activities that might prevent, delay, or stop the development, enactment, implementation, and enforcement of high-impact strategies and interventions to reduce the harmful use of alcohol. They are also invited to take concrete steps towards eliminating the marketing and advertising of alcoholic products to minors, to eliminate and prevent any positive health claims related to alcohol, ensure within regulatory or co-regulatory frameworks the availability of easily understood consumer information on the labels of alcoholic beverages, including composition, age limits, health warnings, and contraindications for alcohol consumption. They are invited to avoid the circumvention of existing regulations for alcoholic beverages and the targeting of new consumers groups with alcohol marketing, advertising, and promotional activities. This is especially related to the no and low alcohol production and marketing that has really increased the last years. They are also invited to contribute to the elimination of sales of alcoholic beverages to minors and to elimination of commercial activities targeted towards other high-risk groups. They are encouraged to refrain from engagement in capacity-building activities outside their core roles that may undermine or compete with activities of the public health community. They are also invited to refrain from funding public health and policy-related activities and research to prevent any potential bias in agenda setting emerging from the conflict of interest, and to cease the sponsorship of scientific research on the public health dimensions of alcohol consumption and alcohol policies and its use for marketing or lobbying purposes. So we think that all these paragraphs in the Global Action Plan can, in fact, help us considerably by creating an operational frame for the protection of undue influence at the national level. So what is the processes for country support? So basically, when you put it all together, we have the technical guidance, the programmatic action and advocacy, communication and resource mobilization at the global level. This is manifesting itself in implementation, protection and monitoring at national level, and we have a safer country that people can have less alcohol-related harm in. And one of the ways that we are working is in-depth country workflow, where we have really considerable efforts at the country level. This usually starts with that the Minister of Health invites the SAFER initiative to implement SAFER together with them at the country level. And then we begin a landscape report, and we are investigating the institutional context analysis, and we are also looking at all the other background variables which are needed for a successful implementation of SAFER. That is the preparatory phase. And then we start the alignment phase, usually with a joint mission to the country, together with the country, discussing what should be the priorities of SAFER interventions in the country, and how should the roadmap look like. And then the roadmap is developed, and that ends the alignment phase. Then starts the implementation phase with the roadmap implementation, but also in parallel we have developed an alcohol control investment case, and that is then launched in the implementation phase, and together with the SAFER monitoring system, which have been developed at a global level, but needs, of course, adaptation to each and every country level. One example of an in-depth country work is Uganda. In June 2021, we received a letter through the WR expressing interest in implementing SAFER at the country level in Uganda. From August to November, we produced a landscape report. Then we had a joint programming mission led by the Minister of Health in Uganda with civil society partners, UN family, and WHO colleagues from all three levels of the organization. Then we had developed a SAFER Uganda roadmap with 45 actions supporting achievement of 8 objectives. And now we have started the implementation of the SAFER Uganda roadmap. And we have developed a governance structure. Last month, Uganda Minister of Health was awarded a 2022 UN Interagency Task Force and WHO Special Program on Primary Healthcare Award for their efforts to reduce alcohol-related harm in the country. And in November next month, we will, for the first time, be part of a national conference and utilize that as an opportunity for capacity building, awareness creation, and network production so that we can work together for a safer Uganda. Here is just one picture from our mission where we also visited alcohol producers, but a different type of alcohol producers, that is community level, who have nothing else to do than produce alcohol. And that is part of the challenge. And here we also met at the same time with parliamentarians and key decision makers and policy makers in Uganda. So a broad spectrum that we experienced during the mission. So here is the governance structure that we have established on Uganda, and hopefully which will then facilitate implementation of the roadmap the next 12 to 24 months. We have a similar process with Nepal. In December last year, we received a letter. In a couple of days, we go on the mission and we develop the roadmap together with the Nepalese, and then we start implementing it. So to wrap up, what are the current and upcoming activities in SAFER? First of all, we are continuing implementation of the SAFER in-depth country action. We hope to expand it to 3 more countries in 2023. In addition, we want to start a SAFER cross-country action. Instead of working in depth with one country, we work in a pool of countries, 5 to 10 countries, with capacity building through workshops and webinars, and try to find out how how SAFER can be taken forward in the countries. We hope for 10 countries in English and 10 countries in French or Spanish next year. And of course, developing further programs, activities, and or memorandum of understanding, not only inside the Global SAFER Initiative, but also with partners directly linked to SAFER, or also not necessarily directly linked to SAFER. continue development of technical tools and guidance, finalizing the alcohol-specific investment cases, finalize the development of safer monitoring and surveillance system, and develop concrete guidance on how to protect safer implementation from vested interests. But also we need very much concerted advocacy and fundraising activities for the initiative, including a global Safer conference next year. And finally, we are still working on the governance structure for Safer. We know that many of you would like to join the Global Safer initiative, and we have still not been able to develop this structure, but we hope to have it up and running next year. So this ends my presentation about the Global Safer initiative, and I thank you very much for the opportunity to present it here at the Global Alcohol Policy Alliance virtual event. And thank you very much for your attention. You will find more information at our webpage, who.in/initiatives/safer.
Every year, harmful use of alcohol is responsible for 3 million deaths and 5% of the global health burden, from road traffic injuries to violence, abuse and neglect, to diseases like liver cirrhosis, heart disease, cancers and tuberculosis, to mental health issues like alcohol dependence, depression and suicides. But what can we do about it? Well, the WHO's global strategy, endorsed by member states, aims to reduce the harmful use of alcohol. Unfortunately, implementation of the strategy is uneven. Meet Nina. In her country, there are very few government regulations on drinking. Nina is out with a friend. The alcohol is cheaper than bottled water, and the bar stays open till 4 AM, so people are encouraged to stay out late and drink more. Nina's friend falls and hurts herself. Now meet Amya. Her government has introduced pricing measures on alcohol, and there's a mandatory closing time for bars, which means Amya and her friend leave for home at midnight. Amya decides to take a taxi, because the police in her country are very active in enforcing drink driving countermeasures. But in Nina's country, the police don't enforce drink driving laws at all, so she decides to drive her friend home. She is way over the limit and crashes her car. Nina and her friend are taken to hospital, using up the time and resources of busy nurses and doctors. Nina's injuries aren't serious, and once they're patched up, she is released immediately. But when she gets home, she is told that her friend died in the car crash. In Amya's country, if people display signs of problems with drinking alcohol, they are offered help early. Amya's country also has restrictions on alcohol advertising, unlike Nina's, where young people can be persuaded to drink to excess by cleverly targeted commercials. If governments implement the WHO's Safer initiative, they can change people's relationship with alcohol, making our world less like Nina's and more like Amya's. Be safer. Strengthening restrictions on alcohol availability. Advancing and enforcing drink driving countermeasures. Facilitating access to screening, brief interventions and treatment. Enforcing restrictions on alcohol advertising. Raising prices on alcohol through taxes and pricing policies. Safer is a WHO-led initiative that follows the global strategy to make our world safer from alcohol-related harm.